Metaplasia is simply defined as a replacement of one cell type into another cell type, can be further described as a reversible substitution of one type of fully differentiated group of cells into another within a given tissue. These metastatic cells originated from cells capable of undergoing cell division coming from the so-called reserved cells or from basal cells. It usually occurs in epithelial cells. One thing to note about metaplasia is that it can become a precursor for neoplastic transformation.
To 6 days later, 4 to 6 more days later, moments later, more moments later, 1 semester later, graduation day.
A key reason as to why these transformations happen is due to the constant exposure of cells to stressful stimulus that is particular to a certain cell type. For example, in Barrett's esophagus, hyperacidity at the stomach can cause acid reflux into the esophagus, causing the replacement of its squamous cells, its columnar cells, as an adaptive response to withstand the acidity. But then, it is said to be a reversible process, so that when the stressful stimulator is removed, the tissue within the area of metaplasia will return to their normal state. Another example is in the lungs, in which the normal pseudostratified columnar epithelium will change to squamous epithelium due to cigarette smoking. But then, it is said to be a reversible process, so that when the stressful stimulator is removed, the tissue within the area of metaplasia will return to their normal state. It is common in middle-aged and older adults and is 2 to 3-fold more common in men than in women. Risk factors in having metaplasia are patients with symptomatic gastroesophageal reflux disease or GERD, central abdominal obesity, those who are habitual cigarette smokers, those who have vitamin A deficiency, and cancer risk patients in the esophagus, cervix, lungs, and stomach. There are 2 kinds of metaplastic transformation that is named after the cell type it changes to after. One is the more common variant, the columnar metaplasia, which brings change from epithelial squamous cells into columnar cells. Another one is squamous metaplasia, changing from epithelial columnar cells into squamous cells. These transformations can happen on various parts of the body, such as the lungs, esophagus, cervix, and urinary bladder. There are various ways in which metaplasia can be treated. For gastric intestinal metaplasia, this can be done by the removal of the H. pylori infection. For Barrett's esophagus, treatment may differ depending on the degree of dysplasia. It can be either by invasive procedures such as esophagectomy or endoscopic surveillance, or the less invasive treatment such as radiofrequency ablation and photodynamic therapy.
In summary, metaplasia is considered to be an adaptive change due to a change in the environment of the epithelial cells that can occur in various parts of the body. It is generally reversible, but if it happens persistently, it may lead to a reduced function of the organ, and worse, it may lead to neoplastic transformation.
This has been a brief yet wonderful discussion about metaplasia. I hope you learned something from it. Bye!